So the next presentation will be from the Social and Behavioral Sciences Core. Amy?
Thank you. Good afternoon, and thank you for sticking around. My name is Amy Cornelia, and I am the new director of the Social, Behavioral, and Sciences Core. Before I get started, I wanted to do a big thank you to Hiv Stigma and Melissa Watt. They have been the leadership of our SBS Core from Kathy from the start, Melissa almost from the start, and have set up a wonderful core, which I'll talk to you about today in terms of what we've done in the past and where we're going in the future. But Kathy was the founding leader of the SBS Core, and she recently left earlier this year to become the chair of the Social Medical Sciences Group in Columbia School of Medicine. And Melissa Watt is also leaving at the end of the year to go to University of Utah Department of Population Health Sciences. And actually, Melissa was supposed to be standing here right now giving this presentation. She's the one who created it. She unfortunately got stuck in Utah coming back. Her flight was canceled. She's now on a plane now, so I will do my best to present what she was hoping to get across and have her last opportunity to actually speak with all of you. So for moving forward, now that Kathy and Melissa left, we took a new approach to core leadership, where we have an overall director and then 3 associate directors. And we really wanted to reach out and go broader and try to include a variety of expertise and disciplines with our core. And so I'm with Population Health Sciences. Michael Relfus is right in the front. He's with Nursing and Global Health. Sarah's still back here, Sarah Wilson. She's with VA and Psychiatry and Behavioral Sciences. And Christina Mead was also here. She had to leave early. She's also with Psychiatry and Behavioral Health Sciences. And I'll talk a little bit more about what each of us are doing in a few more slides. But we also are going to have a core coordinator that will also help, and all of us get together to provide services to you that need them. And we'll talk more about what specifically we can do for you. These are the goals of the Office of AIDS Research. Hopefully they will change their name as well to be the Office of HIV Research. And what I think is a big important factor that we want to get across is social and behavioral research is intertwined in all types of HIV research. Clinical outcomes, health services research, behaviors are always part of that. And that's what our core can help you do, is think through what are those patient behaviors, what are those participant behaviors, and how can we change behaviors, how can we measure behaviors? And of these 4 research priorities, we work in the first 3 that our core specializes in: reducing HIV incidence, really focusing on testing and linkage to care, PrEP. We focus on getting the next generation of new HIV therapies out there, focusing on engagement to care, or engagement and care adherence, and addressing comorbidities, specifically focusing on mental health, stigma, substance use. We do not do anything right now with research toward a cure. And this just shows you of the past 5 years, the grants that have fallen into these areas. We've had 59 grants that our SBS Core has helped investigators here at Duke get funded in some aspects. We either provided a peer review, helped provide measures, some way they came to us and said, we need some help in coming up with some social behavioral aspects of our studies. And so with our new core leadership, each one of us is responsible for one of those areas. I'm looking after biomedical prevention, Michael's focusing on HIV care and engagement, Christina's focusing on HIV comorbidities, and Sarah's focusing on implementation science and community engagement. And in the next upcoming year, there'll be a lot of new things that are coming out of our core that focus on these different areas. Lots of chalk talks, different types of literature reviews and such that help get people more engaged in these areas and more familiar with what we can provide. Now I'll talk about the 4 aims that we've had before and how they were they continue on with the new CFAR as well. These are the HIV care continuums, the prevention continuum and the care cascade, which all of us are quite familiar with. In the past, the SBS Core has really focused on the HIV care cascade and has done a lot of work in that area. Moving forward, we're switching more to work on the HIV prevention continuum, really with that push of what Jacqueline was talking about earlier about ending the epidemic. We're really focusing a lot on prevention. This aim, we will continue to do our best to try to enhance the rigor of HIV research throughout the grant cycle. And I'll focus on two things here. And we work with investigators throughout, from when they're funded to when they publish their results. But two areas I'll talk about is we do a lot of work with folks who have an idea, but they just want to talk about it and brainstorm a little bit. What might that idea look like? And let's just get a bunch of minds together and think. And so we do that. And then we also do peer review. And this really is our most utilized service, where you have a bunch of NIH-funded research in the room, also researchers that sit on NIH panels, and they review your grant before it goes in, and they will see all these leaps of logic or areas where you can be, clearer. And then when you really submit that to NIH, you're a step ahead of other people that don't have that type of service. We will continue and have in the past to build individual and collective capacity among folks here at Duke. And here's a nice slide of all the things that we have been involved in. And so there have been a lot of K awardees that either SBS core members have served as mentees for, or we've helped them in some aspects in terms of developing that K, in terms of doing a peer review, helping them think of measures, brainstorming on what that K might look like. We've had some support of CFAR small grant recipients. That's something I hope to see us growing in the next couple of years, is having more SBS researchers apply for those small grants, because it really is this excellent opportunity to get funds, to get preliminary data, to take it to the next level. And I really hope we see more SBS type studies. We try to be involved in the recruitment of new faculty, and we've had 2 new faculty join. Tierney Richwood, who was here earlier, she still may be, yeah, there she is, still there in the back. And then Marta Muala, who was here, but she may have left as well. So those are 2 new SBS-related faculty that are here. We continue to mentor trainees at Kilimanjaro Christian Medical Center, and John's heavily involved with that in Tanzania. And what we do is there's a lot of people like us that are working at KCMC that are, growing researchers, and they need help in doing social behavioral work as well. So we help mentor them, we help provide peer reviews, we help doing that type of work. And there's also, for those of you out there that work in any type of partner institution, specifically in research poor areas where you are trying to build up a research portfolio there, or a research program there, that's something that we can also help those investigators there that are your social behavioral colleague, help them to build up their work. And we also do a fair amount of collaborations across CFAR, specifically the UNC CFAR, and I'll mention that a little bit more on the next slide. And then our aim 4 is expand reach and impact of SBS research through community engagement and dissemination. In the past 5 years, we've focused on these 3 areas, doing our best to get that information out to the community. And moving forward, we want to continue to do that. But also part of Sarah's role is really engaging the community as much as we can at the beginning, and really thinking about what are the ideas that we want to do together, that our community feels that are important, and that our researchers can bring to get those data to the table to help communities make informed decisions. And so Sarah will be in charge of that. We wanted to point out these 4 investigators. These are all clinical investigators doing clinical work, but as I mentioned earlier, clinical outcomes are all related to health behaviors. And so all of these investigators here worked with the SBS Core in some aspect in terms of helping to write their case or their R01s. And the other thing I wanted to point out with this is 3 of these individuals had small CFAR grant awards. And so they were able to collect that preliminary data and use that to get that funding. So it just shows another way of why that mechanism that CFAR does is so valuable and important. Another area that our group has done a lot of is an HIV stigma. There was a Fogarty opportunity a couple years ago. These 3 investigators applied for it. SBS Core helped them think through that, helped did a peer review. 1 was funded in the first round, 2 were funded later on when a new announcement came on, and so all 3 of these are still working on these aspects in Tanzania and East Africa with Michael, and in Kenya with Megan. And so we do work globally, but we also do work domestically, and we really are focused on the Southern epidemic, as that's also, as listening to Jacqueline, where a good focus is. And so these 3 researchers here all have a variety of studies, one focusing on Black MSM, another with PrEP among adolescents, another with PrEP, all 3 of these are PrEP, with salon and salon-based intervention with women. All of these are with UNC partners, but it shows how we are having a growing research portfolio among addressing the Southern epidemic. And to continue on that, the government did come out with a CFAR opportunity, which was quite lovely, where the CFARs could apply for these planning grants, a $100,000 planning grant. Each CFAR was allowed 3 applications. We submitted 3, and 2 of them were funded, and they had to focus on specific areas in the U.S. And so we had one funded to work with Mecklenburg County, working with Black MSM on PrEP uptake and adherence with our community partners of RAIN and Amity Medical Group. And then we have another one with Meredith Clement, who was at Duke, who's actually at LSU, and she was here all day today, but she may have already left to catch her flight. And that's working with Black women on PrEP uptake and our community partners, the Brotherhood. Just to wrap up, I wanted to give a shout out to Ramel Mwamba. She's served as a study coordinator somewhat along the way, and she's doing an upcoming Chalk Talk on NIH diversity supplements. We will have more information that comes out later on about when specifically that will be. But if any of you out there want to learn more about how to get a diversity supplement, come to this. Or if you've been involved in getting a diversity supplement, we'd love for you to be on that panel and talk about your experiences. And then lastly, just as Colleen was mentioning, we really are here to help you do your research. That's the whole point of CFAR, and that's the whole point of the SBS Core, is to help you do some really rigorous social behavioral sciences research. So please reach out to me. We'll eventually have a study coordinator who will be able to coordinate, reach out to you. We have a lot of new ideas that our new associate and directors have that we will let you know about. But we definitely want to hear from you if you want to be more a part of our group. All right, thank you.
Any questions for Amy? Okay, thank you.